Hello, everyone. My name is Kumiojo, and throughout the summer, I've been writing a literature review on excess mortality during the COVID-19 pandemic. Excess mortality is exactly what it sounds like. It's widely defined as the excess number of deaths in 2020 compared to the predicted number that is estimated through trends analyzed from previous years. So in academic terms, the counterfactual. Lots of research exists on this excess mortality during the COVID-19 pandemic due to its overbearing presence on the global scale. But in this TED Talk, I will be highlighting the three main points synthesized from various literature I've read on trends in excess mortality throughout the pandemic. The first 2 points are the biggest factors that have affected excess mortality, age and race. And my last point will simply be summarizing the other smaller, yet still consequential factors that have affected mortality. To begin, let's talk about the age component. Anyone could observe the large increase in mortality after the first case of COVID-19 in the US on January 18, 2020. Many factors contributed to excess mortality, but various studies have shown age to be the most decisive independent factor for mortality. Although the relationship between age and mortality evolved throughout the pandemic, this shifting trend rests in the decrease in mortality rates from older ages versus the younger. In a May 2022 study conducted by Princeton professor Dr. Irma Elo and her colleagues, they found mortality to fall by a higher percentage for older ages in comparison to younger ages for all racial and ethnic groups. For 80 to 84-year-olds, their mortality decline ranged from 57% to 79%. Meanwhile, ages 25 to 44 years old had an increase in mortality rate as the pandemic continued, despite the emergence of vaccines. Vaccine availability affected the relationship between age and mortality, as older people were more protected and younger people were less likely to get the vaccine. Between race and mortality, racial disparities declined in terms of COVID-19 vaccination as minorities maintained protective COVID-19 measures, while the white population became vaccine hesitant and less likely to adopt safe COVID-19 behavior. Although age is the biggest factor to impact excess mortality throughout the COVID-19 pandemic, race is also a consequential component that is associated with excess mortality. Sadly, like every other global health issue, there was a racial disparity in excess mortality by both COVID and non-COVID-19 causes. A study done by Dr. Polyakova, a health economist from Stanford, and her peers show that excess mortality at the very beginning of the pandemic, around April 2020, was exponentially higher for minorities compared to their white counterparts. These findings were a start to find that Black people had almost 5 times more excess all-cause mortality than the white population. These findings were supported by a later study published by Dr. Meredith Sims and her colleagues, which found non-COVID excess deaths to be 2 to 4 times higher in Black, American Islanders, and Latinx people. These deaths were caused by diseases already disproportionately affecting minority populations like diabetes, heart disease, and Alzheimer's. COVID-19 did not create these disparities, but rather widen and expose them to our society throughout this ravaging pandemic. Although I must note a recent study conducted by Dr. Irma Elo from UPenn that uncovered unexpected patterns in mortality trends among the white population. With minority groups like the Black and Hispanic population, on average, their mortality rates went down from March 2020 to October 2021. But surprisingly, the mortality rates for the white population increased as the pandemic progressed. This could be due to personal behavior and belief, manifesting an unsafe COVID-19 behavior, vaccine skepticism, or political affiliation. Lastly, other smaller but still impactful factors that contributed to excess mortality are health coverage, location of residence, and comorbidities. More healthcare coverage leads to less mortality, hospitalization, and COVID-19. At the beginning of the pandemic, insurance coverage was more important with testing and undoubtedly the quality of care once testing positive. In terms of location of residence, those in long-term care facilities, including nursing homes, categorically had 2 to 4 times higher COVID-19 mortality rates than the community-dwelling population. A final factor in excess mortality is the multi-pronged presence of comorbidities during the pandemic. The first prong is that pre-existing medical conditions were worsened by COVID-19. The second is the disruption of medical care due to the overbearing nature of the COVID-19 pandemic. And the final are the fatal morbidities caused by COVID-19. Although this last reason has little research because the long-term effects of COVID-19 are not completely known, if at all. In conclusion, age is the largest factor that determines mortality during the COVID-19 pandemic. Following age is race, with large racial disparities existing within mortality directly attributed to COVID, but also indirectly due to disruptions within medical systems and societal spaces. These findings are grim and seem to be no different than any public health crisis that harms minorities more due to systemic racism within the healthcare field and socioeconomic conditions. But I hope this quantitative research will be utilized by policymakers to enact impactful policy aimed at addressing these disparities. Thank you.